Welcome to the Align and Abide podcast with Dr. Kim Tran, where we help you achieve your greatest God-given potential. Now, let's get started with the show.
The following program was pre-recorded and the views expressed do not necessarily represent those of this station or its management.
Health is wealth.
7 zeros in your bank account, an incredible family, your dream job. You could have it all, but if you're in pain, not be able to enjoy a moment of it. This is Health is Wealth, where your health is your greatest investment.
Best decision I ever made.
Here to help you get and stay healthy, it's Dr. Kim Tran from Minnesota Integrative Health.
Hey, it's Dr. Kim Tran here, host of Align and Abide podcast, where we explore ways to elevate your life through holistic health and wellness, personal development, and entrepreneurship. Together with health and fitness experts, we'll uncover how you can invest in your greatest asset, your health, and achieve your God-given potential. Past guests have included the Alzheimer's Association, the Jesus Heals Foundation, and Crosstown Young Life. And a special thanks to Miss Bailey, who introduced me to Kevin Rebman of Return to Play Institute, where they actually have amazing locations located in Edina and St. Paul, where they actually specialize in manual soft tissue therapy aimed at enhancing recovery and performance for athletes and individuals recovering from injuries. And if you are looking to start your path towards better health, give us a call today. This is Dr. Kim Tran, and you can find me at 612-545-5672 or online at drkimtran.com. That's drkimtran.com. Now to my favorite guest of today, Kevin. I am so glad that you're here. I know as the chief myofascial therapist, what really made you so excited to just and passionate about starting Return to Play?
Well, first of all, thank you, Dr. Kim, for having me here today. This is great. So, I actually sort of fell into the myotherapy world as a EMT who used to work with young kids in sporting events and stuff like that. I just had this quest to find out what else I could do besides ice and bandages. I wanted to be able to do something else for those cramps, those little muscle strains, stuff like that. And so I basically fell into massage therapy, but I didn't want to do the fluff and buff. I wanted to get into the clinical part of it. Mm-hmm. And that really led my quest to get to where we are today with Return to Play Institute.
Yeah. Now, can you give a little background on Return to Play Institute? What makes it so different from just, let me just go to the spa, let me go get a little massage? What would you say is the difference for that?
Our biggest difference is that we are clinical, first of all. So we're going to focus on things specific to what the issue is that you're coming in for. We love a good relaxation massage, don't get me wrong, but we don't do that. Yeah. And but we just don't do that because we want to spend the whole time with the client doing exactly what they need to get them to be back in their activity, whatever that may be. And so as we work with clients, our clinic is basically one that's going to focus on the issues at hand, the things that are referring into that or out of that area, and things that they need specifically to get that particular problem or a couple of problems out of the way in the shortest time possible. Everybody wants to get back to the gym right away, and that's what we try to do is get them back out in their activity as much as possible.
Mm-hmm. Now, it's not even just athletes that you deal with. You're actually working with people of all ages.
Absolutely. We start from about 13 on up. We find that the younger kids are a little springy and don't necessarily, have a lot of relaxation capabilities. Their drive is really high and stuff. But 13 on up, and we work with people, not only athletes, but active people, people that are out walking their dog on the weekend or maybe even, like painting houses or doing construction or any of those types of things. It doesn't have to be just somebody who's running a marathon or trying to play basketball or something like that.
Yeah, but also if they are running a marathon, they should definitely see you, right?
Absolutely. A few of our clients have been coming to see us for a long time, and they run, the 100 milers and the 150 milers too, the ultramarathons.
Yeah.
So that's always fun to see them.
Well, and I think it's important. I talk about this with my patients too, is that when we look at care, and this is what I love about what you guys do, is that we're both about prevention and wellness. Yeah. And I think so much of today we're based into a society that everybody wants a quick fix.
Absolutely. Our Western medicine people, we love them dearly, but there's more to recovery, more to healthcare than a shot and a scalpel. And so we love to talk about the natural health and wellness part of it. Having some manipulation of tissues, having some structural adjustments, having all the things that go with what your body just needs to get it out of the little rut that it's in. Absolutely, if somebody needs surgery, yeah, definitely go get it. But don't try to use that as the only thing. It's not, everything does not need a hammer. Let's put it that way.
Yeah, absolutely. I mean, I think about it now with over 70% of the population on a medication. That includes kids, which is disturbing.
It is.
I think what people don't realize is it actually is causing more inflammation. So I'm seeing that, and I'm sure your providers are seeing that as well, that people are becoming in much more inflamed. I think people start to believe that it's okay for their muscles to be tight, that they shouldn't be able to stretch them, that, oh, it's just something that they always had for the rest of their life. And I know for myself, I always explain to people, it's not just about how tight you are. You want to have supple muscles.
Yeah.
And what does that actually feel like for you guys?
Well, there's a whole range of things that we feel when
Sure.
we're working on a body. And one of the benefits that I've had in my continuing ed training is I've actually been in cadaver dissection. So I've taken a body apart with a scalpel and hemostat and seen it from the inside, which just amped up my knowledge significantly. But there are a number of things that we feel in certain tissues in different places that just make everything, you're almost like, well, why did you let it get this way? We're supposed to be, our bodies want to move. We always want to be doing things. So if we're not moving, we're actually doing our body a disservice.
Well, and I think a lot of that is right now, I mean, I run into this, and I know you run into this as well, where people think, okay, well, I'm just going to go get a medication for it. I'm going to go get my muscle relaxer. I'm going to go get my steroid shot because that's going to help my muscles. And then I always mention them. It's such a temporary,
Yep.
it's a temporary fix, and it may not even work for you.
Correct. Yeah. I mean, there's plenty of people that will tell you that they got a steroid shot and it didn't do anything for them. Right. And and so, I mean, you are going to get aches and pains. If you're moving, you're going to have aches and pains sometimes. But the goal is to get those tissues to feel better and basically get recovery done on them if you need to, and get back out to what you like to do. Muscles don't hurt unless there's something going on. Tissue doesn't hurt unless there's something going on. And so it can either be stiffness, it can be an actual trauma, it could be something from post-surgery or any of that stuff. But yeah, tissues, if you just press on your arm, it's not going to hurt. It doesn't hurt on a regular basis. So that's what we tell people is if you can do this and it doesn't hurt, that muscle's healthy. But everything else that hurts does have something going on.
Yeah. So that muscle knot that they always feel like somebody else can work out.
Yep, exactly. And some knots are not knots too. Some of them are just our anatomy, the way it is in our body. And we have to sort of educate it with that as well. People often say they come in to us to get a college education and also get a massage on the side because we teach them so much about their body as we're working with them.
Yeah. And I think that's really important. Most people don't really have an understanding, right? Where this is why we always work with a lot of like myofascial places too, is that, they might come in and they're like, well, they said I have this knot, but it's not a knot. It actually ends up being like a rib out of place or a joint that needs to be adjusted, right? And that's always an important part of how we can all work together on those things, which is important.
Absolutely.
Now, what are some typical symptoms that people come in with when they're coming in to see you?
So most of the time it's, we hear people say, I've got this tightness here. I've got this, this little pain when I do this, and then they make a windmill with their arm, and it's all over the place. And so you really can't tell which motion is causing the pain. But we, a lot of people that come in, unless they're a trainer or some type of healthcare professional, are going to talk about the body in very generic terms, like my shoulder hurts, right? Well, in the shoulder, there's, a dozen muscles, right?
Absolutely.
And so we hear a lot of things about just general movement issues, frozen shoulders, hip issues, pains in the back and in the leg from issues with nerves and stuff like that. And that's just pretty much half of what we treat because most of our clients are coming in for sports and stuff or activities. But we also have the whole post-surgical side, which we'll probably talk about in a little bit here.
Yeah, absolutely. And I think that when it comes down to it, it's not even just about preventing and taking care of things. Yes, you can definitely take care of things after you've had a surgery. So maybe you've already decided that, you had a shot, medication, surgery already, but there's so many things that we're going to be talking about coming up of things that you can do, not only on a chiropractic side, but also with what's happening at Return to Play Institute. Coming up next, maybe you've been looking for that next answer and you've tried other massage therapists, you've been through other chiropractors, and you're looking for a new answer, you can find more information at drkimtran.com. That's drkimtran.com, or give me a call today at 612-545-5672. Hey, it's Dr. Kim Tran back with Minnesota Family Chiropractic. And at Align and Abide podcast, what we really want to focus on is helping you achieve your God-given potential, whether it's through physical, mental, emotional, or spiritual problems, because I truly believe that you can heal at any age possible. And that's why I have Kevin Rebman on from Return to Play Institute. He is the founder and chief myofascial therapist. And, I think this is an important part of what we've been talking about is not only bringing the science into it. I know a lot of people love their fluffy massage, and they start to feel like, well, I went for a massage, but I didn't really do much.
Yeah. Yeah, they when they get a fluff and buff, as we call it, or a relaxation massage, it's one of those things where you feel really good when they're doing it, and as you walk out, and you've got a little greasy leftovers on the skin and stuff, but you really feel like they haven't accomplished what you went in there for, especially if you've asked them for extra time on someplace, and you got maybe 2 or 3 more strokes. I had the privilege of working at one of the chains when I first got out of school, and I could tell you exactly what time of the hour it was based on what part of the body I was working on, because the procedure was so systematic and rigid, and every particular part of the body got touched at a certain point during the hour.
Yeah, I found that was interesting. I went into a chain place because people ask me all the time as a doctor. They're like, okay, well, where do you recommend? Well, I went to a place and I saw the big iPad with the clock up, and it was counting down, and it was new section, new section, new section, new section, which I thought was really interesting. And this is what I always mention to my patients is that just because somebody does massage doesn't necessarily mean that they're good about figuring out what you need. And I think about that as, as a chiropractor, I actually do a lot of myofascial work. I get other people to do it for me because I need to keep my body healthy.
Right.
And this is what I tell my patients that, when we're going through and working through this, you might have a shoulder issue and I could be adjusting it, working through it, but you've got a lot of scar tissue. And a lot of that times happens after they go through, and I find this typically after a shoulder replacement surgery. I think people walk out of shoulder replacement surgery and they're like, hey, great, I got a new shoulder. It's perfect. And then it's not.
Yep. Yeah. And then it starts to tighten up. And then after about 6 or 8 weeks, it gets really stiff, and you can't lift your head up to do your ponytail, or you can't reach the head of the shower or something like that. Yeah. Surgery is a whole nother aspect of soft tissue work that we pick up on, we do. And it really is about keeping the scar tissue away. It really is about reducing the edema after surgery, helping the scars heal better, make sure they're not stuck on top of each other, because there are deep incisions as well as superficial incisions. And then all the work that goes into getting that range of motion back. But we're not doing the exercises, mind you. We're doing the soft tissue work. We let the physical therapists, the chiros, the other people that do the structural part of it take care of their business. But we want to make sure that those tendons and ligaments and all that new tissue that's been stitched up all is moving well now, and also 8 weeks from now.
Yeah. And if you're thinking, all right, so if you're looking at yourself, and you can go look at yourself in a mirror, hopefully you're not driving, so please don't drive and look at yourself, okay? But but if you happen to be at home and you're listening, and I want you to just challenge yourself and go walk up to a mirror and if you've had a shoulder replacement surgery, or perhaps you've had some tightness into your shoulder joint, here's what you're going to see. If you look in the mirror, you're actually going to see that your shoulder is actually rotated forward.
Yes, it is.
Because there's a lot of tightness along the chest. So you're going to feel pain into that shoulder joint, even though maybe you've had just your shoulder replacement. But what happens is after shoulder replacement surgery, all those muscles along the chest tighten up, and then you get a lot of stretching along the neck, upper back, into that shoulder, and then it almost feels a bit weak. And you're like, okay. And then if you try to move it, so go ahead, try to move your arm, right? And then you can find you're like, oh, wait, I can't even reach behind me very well, or you can't move it. That's definitely a sign that you should go and see Return to Play
Yep.
Institute.
Yep,
Right?
exactly. One of the biggest complaints we find after shoulder surgery or meniscus repair is that people can't reach all the way up to the ceiling. They can get up about 90 degrees and get their hand to about the height of their ear, and that's about it. But trying to get it all the way up, they find that there's a huge resistance going on there. And that, unfortunately, is not structural in all cases. A lot of it is resistance from the muscles and the tissue that's been built up in there. So your body resists you a lot more than you think it does. And that's one of the things that you sort of have to work on when you're working on the soft tissue as well, is getting people to relax that part of their body.
And I think a lot of that is sometimes we go to massages thinking it's going to be comfortable, right? But when we're working through scar tissue,
it's not comfortable.
No, it's not comfortable. You're probably, I mean, hey, I hate to break it to you. This is probably not going to be your time that you're going to take your siesta.
Yes,
like you're
that
now.
is correct. Yes. We don't want people to be at the point where they're making a fist or gritting their teeth or trying to tolerate it. That's not what you should do when you're doing recovery work. You want to be comfortably uncomfortable. So you want to feel the pain. You want to tell your brain it's okay. Let those muscles relax. But as soon as you tighten up your fist, even just pinch your fingers together a little bit like that, you're starting to tighten up the rest of your body. And then our effort becomes much more significant because we have to sort of fight through that. So we just sort of take a pause and just have people relax a little bit. And they're like, wow, I didn't think this was going to hurt that much. And it's like, well, it doesn't hurt as much as it could, but we're going to get you through it. So,
yeah, which is a big thing for a lot of people. I think they don't realize that. And I remind people of this too, just because it's painful doesn't mean that it's bad for your body.
right.
And I think we've gotten to this point where there's so many people that are still learning from their doctors, oh, you hurt? Just don't move it. And that is absolutely the worst thing that you could do.
Right. There is no prescription for laying on the couch and eating Pringles. That doesn't exist, okay?
What?
You have to get up and move around. Yes, absolutely.
Well, and what I find too is that people who don't move their bodies are actually worse off than the people that do move their bodies.
Yep, absolutely.
And the less you move your body, you're going to actually build up more scar tissue, more myofascial adhesions, and it's going to be a lot harder for you going through that.
There is a reason why in the hospital after labor and delivery, after a hip surgery, after a knee surgery, you're up and walking the next day. There's a reason for that. Studies have shown in the last 30, 40 years that movement is really a key to a faster recovery. And so if we can keep that scar tissue from building up and keep you from having the pain or resisting your movements, you're going to heal a lot better. It's not, I can't say you'll heal faster because your body only heals as fast as it wants to, but you will heal a lot better.
Now, what would you recommend for somebody else who, they had a shoulder replacement surgery, they had a hip replacement. What would you recommend the timeline it is before they come in to see you?
Well, it might sound a little shocking, but we like to see people 3 days post-op. So we don't mind the stitches, we don't mind the tegaderm and maybe some drains if they have those in there. But what we're going to do is two things. First of all, we're not going to, if they're in a cast or some type of hard thing that we can't get to, we're not going to rip that off and start working on the incision.
What?
No, that's
kidding.
not how it works. No. But most surgeries nowadays just come with some stitches and some tegaderm. And the first thing we want to do is mobilize that superficial, that skin tissue essentially. So what that means is not that you're going to just take and yank and move it around and stuff. You're actually going to just do very gentle movement on that tissue for two reasons. One is to keep the tissue moving, and the second one is to keep the swelling down. And then the second thing is we want to make sure that the other side is not compensating too much. So if you had a hip replacement, it's not the side that you got the new equipment on that we're worried about as much as the other side that's carrying 75 or 80% of the load now while you heal. And that's where you get the low back pains, and that's where you get the pains in the quads and the hamstrings from doing everything on the good side until the bad side heals up again.
Yeah, I know that's a common question that I have with a lot of patients because, sometimes they're coming in. And I just had somebody else who came in who had a hip replacement. And she was like, she called in because she heard me on the radio and she was like, okay, doc, like, how soon can I come in? I'm like, absolutely, just come in right away. And a lot of that is, I think people don't realize is that as practitioners, we will go through and change the way that we do things. We might not do it the same way that you would have seen on a video online about somebody, doing these big movements with chiropractic adjustments, but there are adjustments, there's soft tissue mobilization that can be done right after your surgery that is actually going to allow you to heal much faster.
That's correct. Yes. It's very good when people come in and see us right away. A lot of people don't know, but when you have like torso surgery, whether it's a hysterectomy or C-section or tummy tuck or whatever, most people complain about their low back. And why is that? Because they're actually leaning forward trying to protect those incisions. So we want to help them with that as well. And just getting that tissue loosened up and allowing them to be able to stand up a little bit straighter is going to give them a much better quality of life while they're healing and waiting to get back to the gym and that stuff.
And I think that's really not touched on as far as pregnant women. I mean, I've seen women who've come in right after they've given birth. Sure, they may have gotten a C-section and been like, okay, well, we need to start working on your scar tissue.
Yep.
And they're like, well, I don't really notice it quite yet. And I'm like, yeah, because you're still on your high from labor. We forget our bodies, especially as women, when you go through and give birth and you have a C-section, you have hormones and you get this adrenaline kicking in that you're like, your body is on this high. So you don't think that much about the scar tissue to start with. And then eventually it's a few months down the road, if somebody hasn't guided you, that all of those things start having problems later.
Yeah, it's very important. And not only that, but if you don't pay attention to the scar, eventually, if the doc tightened it up a little too much, you might get it to start inverting. And then people are like, why is my scar so deep? And why is it way down there and stuff? And so if you keep that scar healing properly and keep it from tying into the lower tissues, the inner tissues, then that scar has a better chance of laying flat and you can, look good about, going out to the beach and stuff like that.
Well, and I think it's interesting for both of us who've worked off cadavers before in school, that people don't realize how many layers have to be cut of the tissue in order to even get to the uterus.
Yep. There's a lot in all places. I mean, one of the favorite questions I have for my clients when they first come in, like 3 days after surgery, is tell me what the doc cut through. Is one of the questions we ask them. And a lot of times they don't know. So when they go in for their first post-op, I'll say, have the doc explain to you which muscles they actually had a stitch and which muscles they didn't. And even like hip replacements, I mean, they might cut glute medius, but glute max might just be pulled out of the way, just retracted out of the way. And that makes a big difference whether the muscle is stretched or actually cut.
Yeah, absolutely. So coming up, we're actually going to be talking about, well, if you are deciding that surgery is where you need to go, or maybe that was your only option, what can you do to actually prepare your body for surgery using chiropractic care, using myofascial work? And if you're looking for any other information, you can go to drkimtran.com. And if you're looking for more information for Kevin, give him a reach out at returntoplayinstitute.com. Hey, it's Dr. Kim Tran with Minnesota Family Chiropractic, back with Kevin Rebman of Return to Play Institute, located in Edina and St. Paul. A lot of what we've been talking about is perhaps you've gotten to the point where maybe you've tried some chiropractic before myofascial work, and we're going to be getting into, okay, well, why is this different compared to, yeah, sure, maybe you went to one of the big chains and you went to go get a massage and you're like, well, I walked out, but I still feel the pain. Or perhaps you feel like maybe you're up to a point where, and I've had this with some of my patients, and I know, Kevin, you've had this with your clients as well, that they get to the point where their joints have degenerated so bad, whether it was from a medication of too many injections, or perhaps just a congenital infirmity, that they feel as though they have to go through the surgery. And yes, there is a time and a place for any of those things. Now, one of the things I actually discuss with patients is, one of the best things that you can do is prepare your body before you have the surgery. And for those that have to go through a surgery, I have somebody else coming up that has to do a hip replacement. And some of that is, I said, okay, well, keep coming in. Let's keep getting you adjusted so we can make sure your body is the most aligned possible for the best surgical outcome. And I know that you feel a lot of that is the same.
Absolutely. So with hip surgery, as a good example, first of all, not all hip surgeries are necessary tomorrow. Okay.
Absolutely.
There's a lot of clients that we see that maybe have a torn labrum, maybe they've got some issues with the joint degenerating and stuff like that, where if we can work on the soft tissue along with our chiropractic friends, we can actually get that hip to feel okay for maybe a year or 2 years down the road, and they don't have to get the surgery right away. A lot of surgeons will say, well, how old are you? Are you 30, 40, 50? How old are you? Because hips don't last forever, right? They always talk about a lifespan of a hip replacement, 20, 30, 30 years, something like that. And so if you can put off the hip surgery and still feel good, still do things. I don't mean put it off and just lay in pain, but if you can put it off for a year or two, that means that you'll get another year or two later down the road. And quite a few clients have come in, and for 2 years maybe, we've been able to keep it at bay until their joints have actually degenerated enough where it's actually almost mandatory at that point.
Well, and I think a lot of that is, so one of the things that I look at, not only assessing like the muscles, but also assessing the joint. If you can go through and you have full range of motion in that joint, but yet you have pain in the joint, that doesn't necessarily mean that you're a candidate for surgery. Now, the orthopedic doctor, of course, is going to tell you, oh yeah, you should definitely have surgery. I actually tell patients, and I was having this discussion with her recently, is that, look, I mean, like, you have great range of motion in that hip.
Yep.
But she's like, yeah, but it hurts when I have, when I'm working on it, it hurts when I'm walking on it, just because you have pain. And I said, but your muscles and ligaments and tendons, and the hip is a very complex joint.
It is, yes.
You have no idea how many muscles are coming into that area, that if they are tight and you've had a low back problem before, chances are you need somebody like Kevin and his team to actually work through the muscles, work through that scar tissue that you've developed over the years.
Yep.
And I always recommend, okay, go through, let's get you through some myofascial work as well.
Yep.
Because you have great range of motion in your hip. You're just really tight.
Exactly. Now, you have to do a couple of things. I mean, you have to see a chiro. You have to do some exercises. You have to keep those muscles strong. Even if you're going in for hip surgery, you don't want to let those muscles atrophy. You want to make sure that everything is nice and strong before you go in for surgery, because when you come back out, that side isn't going to get used for 2 to 3 weeks, and it's going to atrophy anyway, right? What is it? Something like build it up for 6 weeks and lose it in 2. And so if you are going as a candidate for some type of surgery, whether it's shoulder or hip or whatever, we always recommend that people try to strengthen that as much as they can before they go into surgery. And then the stuff that we do is more dealing with the lymphatic system, which is your immunity system. It's your system that deals with edema and swelling. It's a system that deals with everything in your body except for basically blood flow. And so when we have people coming in pre-surgery, we'll actually do manual lymphatic drainage with them and stimulate the lymph nodes, get those killer T cells and killer B cells energized, or moving fluid around in the body, stuff like that. We don't flush toxins, unfortunately. That's one myth that's in lymphatic drainage. Your body does that very well, but we do help it do that. So,
Well, and I think for those of you who don't understand what edema is, for some of you that have had a lot of swelling, or maybe your legs feel very heavy, maybe they started looking more like elephant legs than normal leg size. That is actually what he's referring to with lymphatic. And we talk about those with edema. And one of the ways to know, okay, do I need some help with my lymphatic system, is you can actually take your thumb, press into that tissue, and if it leaves a big indent, well, you better be calling them up soon, okay?
Exactly.
And I think people don't realize how much that extra lymphatics that is sitting stagnant in their body. So any lymphatic or edema that's sitting stagnant in your body is going to cause more pain, and massage myofascial work is actually found to be very beneficial to helping to move that and encourage that.
Specifically manual lymphatic drainage. Here's a pop quiz for the people who are listening to the podcast today. What are the 2 things that are needed to move lymphatic fluid in the body?
Dun, dun, dun.
And the answer is, the first thing is you need some form of compression, and just having your skin be able to compress against your muscles is sufficient. But if you have problems with edema and swelling, you may want to use like compression socks, or even a wrap of some type, a sleeve. Sometimes you'll see athletes have sleeves on. That's not to look cool. That's actually to help with swelling. And the second thing is movement. If your body is not moving, your lymphatic system is not pumping fluid, because the muscles do the work.
Yeah. And I think that's the thing. Even though we're talking about chiropractic care, massage, myofascial work, the biggest thing is you still have to move your body.
Yes.
I always tell people you have to move every joint every single day. And one of the things that I encourage people is to at least, you got to move your body at least an hour a day. And you can break that up 10, 15-minute increments. We do a lot of vibration plate therapy in our office, but I actually encourage patients who have a lot of edema as well, in conjunction with the 2 therapies, is to actually get a vibration plate and start using that at home to help push the fluid back up.
Yep. Having the muscles move in any form, whether it's a vibration plate, going out and walking the dog, doing planks, whatever it is that you do, just having the muscles move and tighten up and release, that is going to help the lymphatic system. And our bodies swell on a regular basis. They ebb and flow with swelling on a regular basis. If you're doing exercises, you might notice your ankles swell or your wrists swell up a little bit. Marathon runners find swelling in the legs when they get done. That's just normal body function. But if it swells and stays swollen and you have swollen ankles, or as you refer, elephant legs, you don't want that to stay on a regular basis. So you want to get out and make sure that you're moving those, that you're using compression where needed, and also avoiding sodium. We are a society of salt eaters. We tend to eat 3,500 milligrams of sodium a day, and the recommended daily allowance is like 2,500 milligrams. So just cutting back on the salt shaker is going to do a lot.
Well, I would also say probably more of the processed foods, fast foods.
Yes, that too.
I think that most people don't realize is that they actually need to eat healthy.
Yes.
Right. There's as much as we can talk about all of these other therapies, nothing, it doesn't outpace a bad diet.
Correct.
Right.
Yes.
And I was talking about this with one of my patients because he came in, he had like more swelling. And I said, well, what in the world have you been eating? And he was like, well, he does DoorDash. You know that. And so he's like, yeah, I'm just driving around in my car. So then since I'm picking up stuff for people, then he's going through and he's been eating a bunch of fast food, processed foods. And I was like, yeah, how's that working for you?
Yeah, exactly.
And he's like, it's not working. And a lot of those things are, you have to eat whole foods.
Yep.
And if you want the best experience from these things too, in conjunction with what you do, eat a great diet. I mean, a simple fact is, if you eat fruits, vegetables, meat, fish, good fats, if you keep it that simple 80% of the time,
yes,
you'll be amazed at what happens. Now, for those of you that have actually been through cancer treatment, and I know cancer is also one of the major things that causes edema. That is, when you're going through that, I know that some people will start to see some weeping into their skin.
Yes.
Yep.
And do you want to keep on
you,
going? Sure.
Yeah, go right ahead. So now a lot of times when people have weeping on their skin, and you can explain that a little bit more, is everyone qualified to work on that as a myofascial therapist?
Well, first of all, myofascial is dealing with the fascia itself, right? Manual lymphatic drainage is where the lymphatic system gets treated. First of all, you can learn manual lymphatic drainage in 40 hours, and that's something that you can do on a healthy body, no contraindications, no problems, and that's the basic course that's taken. Those people are not qualified to work on cancer patients, lymphedema, lipedema clients. You really need to go through a complete decongestive therapy course, which is a physical therapy level training that we have gone through, because you don't have to be a physical therapist to do it, but you're talking somewhere in the neighborhood of 200 hours of training. And there's not a lot of therapists out there that are willing to commit that much time for something so specific as lymphatic work. Cancer patients, people that have had surgeries, people that have been in car accidents, people that have had just regular accidents from whatever, if you've traumatized your lymphatic system, you are at risk for having lymphatic issues, because the lymphatic issues deal with trauma to the body. And if we damage the lymphatic system, you might get a swollen arm, you might get a swollen leg. So cancer patients that have the weeping in the skin and stuff, that's actually the lymphatic fluid perforating through the skin or perfusing through the skin. And that is a severe case of edema, essentially. We don't want it to get that far. If it gets that far, then we've got a whole lot of other problems going on.
Yeah. Oh, of course. And even then, I know like one of my other cancer patients, when she started getting the weeping, she actually still really benefited from getting that lymphatic massage done because it helped to relieve her pain. And I just want you to understand is that if you're going through that and you're going through cancer treatment right now and you're dealing with that, be really choosy about who you go to, right?
Yeah.
And if you've been looking for more information on really who's comfortable working with top procedures like this, you can find out more at drkimtran.com. That's drkimtran.com. Hey, it's Dr. Kim Tran with Minnesota Family Chiropractic. If you've been looking to transform your life and health, give us a call today at 612-545-5672 or find me online at drkimtran.com. That's drkimtran.com. On today, we have a special guest, Kevin Rebman, which you recently just published a book, which is amazing, on the ultimate guide to healing after surgery.
Yes.
Where can they find your book?
So it's available on Amazon and Barnes & Noble. We also have our own website if you want to buy it there. It's www.methodandmythmedia.com. I picked those terms because it's we have methods, but also there's a lot of myth in our industry. And the book is basically focused around recovering from surgery. It starts about a week before your surgery, how to plan, how to vet your surgeon, and the place that you're going, because a lot of people we deal with go out of town for surgeries. And then it covers everything after surgery up to about 12 weeks, nutrition, compression, the psychology aspects of getting surgery, how your brain plays games with you the first couple of weeks, and what you should be eating and stuff like that, how you should be moving, exercise. It doesn't cover anything lymphatic drainage wise. It's not going to give you techniques for reducing the swelling like we do, but it is something that you can cuddle up with in your healing nest, as we call it, and sort of read chapter by chapter. Or if you have something specific you want to know, you can go right to that section. You don't have to read it from cover to cover.
Absolutely. Now, what is the important part of having people come in after surgery?
The most important part is, first of all, they can ask us anything they want, right? I mean, you come in 3 days after surgery, first thing we're going to ask you is, how are you feeling? Are you hydrating? Are you getting some nutrition? And are you having bowel movements? Because after surgery, you're all stopped up. And so we're going to ask questions like that. And we're going to ask you how everything went. And then we're going to get onto your body, onto the areas that you've had surgery, areas that you haven't had surgery. And we're going to start working some of the things that we know are issues that show up right away. Of course, everything is with client permission. We don't do anything without asking them if it's okay. And we go through a pretty good intake at the beginning. So you really know what's going to happen during the appointment before you even lay on the table.
Absolutely. Now, what are some issues that you see right after surgery?
It can be anything as simple as, I don't know if my incisions look good. Why do I look like I've been hit by a bus? Where's all this bruising coming from? How come I'm bruised on my knees when I had a tummy tuck, for example? Or it could be things as bad as, like, what is this red stuff along my incision? Is that an infection? Should I go see my doc? And we always err on the side of caution. If there's something that we think is a problem, we're going to say, get a hold of your doc. Let's take a picture right now and let's send it to them. And then we'll do that with them. And so these questions are that people come in with that their docs haven't really answered or given them any information about what to expect.
Yeah. So why do they have bruising in their knees after they've had abdominal surgery?
Yeah. So the simple answer is gravity is always in force. So gravity is pulling that lymphatic fluid, those blood components that got into the tissues, down into the legs along with the lymphatic fluid, because your legs are going to swell up with abdominal surgery. And gravity is always in force. So we try to turn that around a little bit and push that stuff back up into the torso.
All these other special things. It's like the greatest secret that you guys get to find out today.
Exactly.
Their greatest secret in the Twin Cities and go.
Now, we love our post-op clients. Just had a client in not too long ago that had a breast lift. She's done with kids. She wanted to look nice and stuff, and very interested in what everything was happening, what was going on with the healing of it and stuff like that. Why were these strands of fibers that were developing around the breasts and stuff, and are those necessary? And they're not. They shouldn't be there, right? So we have to work those to get those to go away. Making sure the incisions lay flat. Nobody wants an incision that looks like a mattress seam when they're done, right?
Really? I thought that was a good idea.
Nobody wants train tracks along their incision either, right? So we have this whole protocol that we go through with the client and teach them how to do it for the next 6 months so they can get that incision to look a lot nicer as it starts healing and becomes more skin color as opposed to staying red and angry looking.
Yeah. Now, what would you say to somebody else who they have a hip surgery? I know what I talked to people about. So I had a client that came in and she's like, well, I have hip surgery, but now I'm getting like radiating pain down, like tingling numbness down to her leg. And I'm like, well, that's not uncommon.
Yep.
probably because you walked in with the problem beforehand. We didn't really fix that problem, but now you've got more problems on top
very
of it.
likely. And your gait has changed. Maybe one of the muscles has changed as well. But, people always talk about sciatic nerve and piriformis syndrome. Those are the two big topics in the hip, right? Oh, I have piriformis syndrome or I have sciatica. And we're like, okay, let's talk about what those are first. And then you can determine if you have them or not. But there's a lot more nerves in the hip than just the sciatic nerve. I mean, there's the gluteal nerve, there's the pudendal nerve, there's all this stuff in the hip that can affect other pain in the hip. So when somebody has a pain in the hip or the glutes, it's not necessarily because they had the surgery. Like you said, it could be something that they walked in with or had before the surgery, or it could be something that they've adopted since they had the surgery and they're changing the method of movement.
Yeah. And I think it's really important to know is that sometimes you're going to get radiating pain into areas that maybe you don't even want to talk about, right? And I know for men and women, getting that radiating pain into the groin, that's not necessarily something you want to talk about, but something that is necessary to tell your provider.
Exactly.
Yeah.
And that's one of the things that differentiates us from other providers. And of course, with client permission, we work on almost everything on the body. There's nothing on the outside of the body, with a couple of exceptions, I have to say that we won't work on. So if there is an issue with something like an adductor, for example, we're going to be all the way up to the attachment on the top and all the way down to the attachment on the bottom. And that's not something a lot of therapists are comfortable with or can work on at some of the other places. We also do visceral work, abdominal organ massage, if you want to call it that. We do diaphragm work. We work on breast tissue for cancer patients and surgery patients. All of that stuff is with training. We've been trained in that over the course of years. We've got thousands of hours of training in that area. But it's something that's necessary. I mean, during COVID, for example, there was a series of clients that we saw that had pain in one of the breasts from the shot site. And I looked it up on a few sites, and actually there was a whole Facebook group about that.
Yeah.
I'm like, amazing. And so different things like that make us really unique. There's really not much in the body that we can't help you with. And that's what differentiates our soft tissue work with what you would get at just a place that does relaxation.
Yeah, and I think that's really important. I actually talk about that with patients because even for myself, I was mentioning to you, Kevin, that I actually go through and get other myofascial work done, and it's not, and people are always like, well, are you having pain? And I was like, it's not because I'm having pain. It's because I work with people. So I want to make sure that I can do what I need to do. And for me as a chiropractor, and this is what I talk about with women, one of the areas that is so neglected, depending on where you're going to some of the myofascial places or massage places, is they avoid anywhere around the breast tissue.
Exactly.
And that is actually so necessary for women because what happens is if you never get that area worked on, then you start developing a shoulder problem.
Right.
So it's not necessarily that you have a shoulder joint problem, but it feels like it.
Yep.
But it's because you have so many adhesions along the breast tissue, along the side of the breast area too. And I think this is important is that you want to go to a place that's comfortable working with these areas that other people won't touch. And same thing when it comes down to really getting into, even the abdominal massages.
Yep.
And people don't realize is that just because if you have bloating that never seems to go away and your stomach feels very hard and firm, I call it like your beer belly massage. you're like, well, okay, maybe I need to lay off the beers too, but but perhaps that's what you need. I'm not saying that's not a thing, but I tell people all the time, it's not normal for your gut to be protruding and hard.
Right.
And if you are having that, that's actually a sign that you can benefit from actually having abdominal massage done.
Right. Exactly. One of the biggest things that we seem to be working on lately is people come in and talk about this pain that goes from their low back and wraps around to the front. And of course, there's transverse abdominis, there's the obliques and everything else that you deal with in the front. And then you've got QL and all these other muscles in the back. But what's interesting is that we find a lot of times they're getting adhesions in iliacus and psoas, which are the two hip flexor muscles. And they're adhering to like the visceral organs and stuff within the abdominal area. So when we're working in the lower abdominal area and we're getting into the side of that pelvis, that just feels really good. good. And people are like, wow, that's where the pain is. That's amazing, And again, it's myofascial, it's adhesions. It's not necessarily muscles that are stuck together from surgery, but there are muscles that are stuck together because you have pressure in there holding them against these other tissues while you're sleeping, while you're sitting around, while you're not moving, right?
One last question for you. Who are the best mentors that have helped you out through this entire process?
Probably a couple of them. One is there's a chiro doctor, Dr. Joe Muscolino, who was in the cadaver dissection as my instructor, and that was awesome. And then probably all of my surgeons that I get to talk to on a regular basis and ask questions about what are you actually doing.
Oh yeah, sure. Who are your top favorites?
So a couple of them in the areas. We have Dr. Joe down in West Woodbridge. We've got Dr. Cayenne out in Minnetonka, and those are pretty much our favorite docs. So.
Oh, awesome. And where can they find you if they want to set up an appointment?
They can call us at 763-270-9330, and you can also text that number as well.
And you can find out more information about Return to Play at returntoPlayInstitute.com. Thank you so much, Kevin, for being on today.
You're very welcome. Thanks for having me.
Thanks for listening to the Align and Abide podcast. We'll see you again next time, and be sure to click subscribe to get future episodes.